About is measurements. So we are planning on making a 12 diameter conduit. So with 12 as the diameter, the first thing is to calculate the circumference. So circumference is 12 into 22 by 7. So that is 2 pi r. Okay, that is pi d. So 3.14 into 12. So that comes to 37.6. So this 37.6 can be rounded off to the nearest multiple of 3. So here you can make it 39. So 39 mm will be the width, circumference of the conduit. Next is the width of each leaflet, which would be 39 divided by 3. So that is 30. Then the height of each leaflet would be the diameter into 0.87. Okay, this is the formula that has been devised by the Japanese. 12 into 0.87 is the height. So that is 10.44. We rounded up to 10.5. So then another thing we need to know for marking here and there is the midpoint of the width. So that is 6.5. So these 4 measurements are what are required to proceed with making of the conduit. Thank you. So these are the things that we will be needing for conduit. First is the 0.1 mm PTFE membrane and the bovine pericardium, and then we need a marker pen. Then 2 sets of sevenoprolene switches. So the first thing is to get these marked to the required specifications. So as we have already seen, the sizes required, so approximately, so we have an idea now, then we take just the amount required. So this should suffice, so the remaining goes back. So as we have seen the specifications for the valve. So it's important also to have this sheet below so that we can keep moving around to our convenience for suturing purpose. So we need to have this metal scale. Okay, so now let's begin the marking. So this marker sometimes it smudges too much. Okay, so what we need to do is just sharpen the tip a little so that the smudge element is reduced. Okay, so the first thing is, so being a 12 mm conduit, so we plan that this patient would need a commercial height of around 3 mm. Okay, so between 12 to 15 it's around 3 mm, then 15 to 20 it's around 5 mm, and above 20, which we rarely make, can give around 5 to 6 mm for the commercial height. So you need to have a certain length of valve tissue above the level of the actual valve height. Okay, that will show you why in the end. So that another 3 mm I give there. So 3 mm, another 3, so the entire procedure will take around 45 minutes to 1 hour. I'm doing a little more slowly just for the demonstration purpose. So it's 3 mm, 3 mm, it in the actual valve height. So this part will be the commissure, and this part is the excess valve tissue above the level of the actual height. Okay, so the measured height was 10.5. So start from here, 10.5, 10.5. Okay, and then we have the width of the valve. So width was 13, and the total circumference was 39. So 13, 26, 39. Again 13, 26, 39. And just separate those leaflets. So each box is going to be 1 leaflet. So the smudge element is a big problem. There's no way to completely eliminate it, so we keep wiping the scale in between like this. And then the midpoint of each leaflet, which was 6.5. Okay, so once we are done with this, we can just draw these leaflets. Keep it as broad as possible. Okay, so once we're done with this, we can just cut the leaflet. No, it's okay. Use the pot scissors for the curve cuts. Okay, so this is the fashioned leaflet that we will be using for the conduit. Okay, the next is to do this exact the same markings that we did on the valve on the conduit itself. Means here in this case the bovine pericardium. Okay, so the smooth side should face up. Okay. And in order to avoid very bad smudging, which will make our life miserable, we dry the conduit initially. Push my chair also. Okay, now we're reasonably dry. So each time we need to do this, otherwise smudging will be significant. Okay, so giving some length this side, we just make the highest point that we can draw a line there. Each time better to have this white 12. And again the same thing. 3, 6. Then the valve height 10.5. Because the light is not correct, I'm seeing only my shadow. $13, $26, $39. I hope you are doing a good job in recording. You need to zoom some more, I think. Huh? Yeah. So once you have made these markings, you can cut the conduit to the desired length. These are the midpoints. This is just to guide. So we spent almost 10 minutes, 5 to 10 minutes in getting these measurements all perfect. Then it's a straightforward job, just suturing them onto. Okay, so these are the measurements. Then we set the valve onto that. Okay, as you can see, both are exactly in alignment. Okay, now the thing is to start stitching. So initially, so now you zoom properly and show. Okay, பண்ணா zoom பண்ணி என்ன பண்ணுமோ பண்ணி நிக்கோ. Use your intelligence. Okay, okay, so first we can just start from one end. Okay, remember that the first 3 mm is the portion above the leaflet. Okay, so the leaflet actually begins from here to here, and this is the commission. Okay, so we take this point and fix it to the conduit. There are several ways to do these things, which you can tailor it to your convenience. So important to fix the midpoint so that the whole leaflet stays in position as you're suturing. So the middle. So since you have already marked everything, the midpoint is that, just need to. It's important that your bites don't go full thickness into the leaflet, and I mean not the leaflet, into the bone pericardium. Okay, after that. Similarly here. So this is how we create the commissures. So starting from here, go outside in, inside out or outside in. 2-3 dots, creating the commissure. Make sure they're seen well. Inside out, outside in. So there we have created this commissure. So once we have begun this suturing process, we should keep the conduit wet, lest it dries up and gets parched. So occasionally the assistant will just wash the conduit. So before that I forgot to show something. So as we begin the suturing, to guide us we just mark the leaflet borders. This is where this one smudges like anything. Just mark the border. This is just a guide to our suture line. So usually we will not be going exactly on the border, maybe going slightly within that margin that you have marked just now. Okay, so that we leave that cusp like. Okay, if you suture it flush on that margin, the leaflets tend to be flat onto the pericardium. So that we don't want. We need some cusp-like element for each leaflet. Therefore, we suture it closer so that cusp-like element is formed as we suture. At this point, the job of the assistant will be just to stabilize the pericardium so that it doesn't raise up as we pull during each bite. There is no need for following or anything. Just follow that guide. We keep it. As you can see, I'm going within that line. To ensure that you don't take full thickness bites through the pericardium. Neither should we eat up too much of the So now we have reached the point of the next commercial. And so these commercial bites are slightly different. So we need to take the leaflet and the bovine pericardium. The bites need to go through the pericardium, so we fix it like this. And then take a deep bite. Okay. So once you have taken that, we can check if we have taken both. Then I usually prefer to come back forehand, so I turn this conduit like that and then go back. So now we have reached the top, so we need to go back now. So 2 more bites. So each commercial will have close to 4 bites. So you can feel that the needle is going through the bovine pericardium. Again, the same principle as we used for the previous leaflet. Stay well within the marked area so that we have some bulge to the leaflet. So in the beginning, wash it. Okay, center probably. So you have the line there. if you've taken a break. Can you just zoom in and show this commission? And then zoom out. Okay, just show this commission. Then zoom back out. So, go back through. Out of focus. Okay. which is important. Okay, this gives that cuspal configuration, and this will happen once we during the suturing process. If we stay inside of that line, so we'll get this. Okay, next step is to just little fashioning of the leaflet. This is a marker. So again, we'll mark them scale again. So we mark the midpoints again, and then we tailor the superior margin of the leaflets. So we go like that and ensure that the midpoint is the highest, so that the cross section edges are well preserved. Be careful not to cut the furniture at this point. Okay, so this is how we have a 3-leaflet configuration, and now the point is to create the conduit. So we just need to have a little length above the level of the. Take a fresh photo of this. होगा. So once you're done fixing the first filter, then take one size regardless. Just hold the conduit up. Okay, and just hold like this. There also all these lines and knots and everything that will guide us to keep our switch line very precise. Okay. Those two knots are the starting points of either end. So at this commercial point, we will be going through the leaflet. Can you do something about that sound, please? Oh, thank you. You passed the connection now. To take a video of this. Okay, zoom in nicely, take. And the testing. You're taking?
Yes, sir.
Nicely zoomed in, no? Okay?
Yes, sir.
Continue. Okay? Change the solution.